Hello everyone! I haven't posted a critical care nursing video lesson in a while, so hello again and welcome back. Let's continue on our topic, the analgesia and sedation in the ICU. As we know, critically ill patients are more sensitive to pain than healthy individuals, and this is known as hypernociception, which is an abnormally increased sensitivity to pain. Common nursing procedures such as endotracheal suctioning and being turned in bed, for example, are two of the most painful experiences for the ICU patients. Furthermore, some of the critically ill patients experience pain while at rest, even in the absence of a noxious stimulus. This type of pain usually affects the back and the lower extremities. And this increased pain experienced by an ICU patient is attributed to their being unable to move or immobility. And of course, the systemic inflammation that the patient have while admitted in the ICU. So, it is the nurse's responsibility to recognize the patient's pain, and this is crucial in promoting comfort of the patient in the ICU. This is an example of pain scale we use in the ICU, the behavioral pain scale. This is a tool that helps nurses in assessing patients' pain. Alright, now let's move on to our main topic, the analgesia and sedation. First, let's define analgesia. What is analgesia? Analgesia meaning loss of sensation of pain that result from interruption in the nervous system pathway between the organ and brain, okay, between the sense organ and brain. So we have different forms of sensation, right? Touch, temperature, and pain. So this sensation stimulating the area, for example, the skin, travel to the spinal cord by different nerve fibers. Therefore, any interruption or any injury or disease affecting the nerve would abolish all forms of sensation in the area supplied by it, or by pain relief induced by the actions of medications. So these medications are called analgesics. These are the medications that used to relieve pain. Okay, they are also known as painkillers or pain relievers. So technically, the term analgesic refers to a medication that provides relief from pain without putting you to sleep or making you lose consciousness. Okay, so analgesic relieving you from pain without putting you to sleep or without you losing consciousness. All right. There are many different types of medications have pain relieving properties, and experts tend to group together medication that work in a similar manner. For example, non-steroidal anti-inflammatory drugs, or the NSAIDs, and opioids, or opioids or the narcotics, are two of the most common types of pain relievers. But there are many others there. Okay. Analgesics are sometimes grouped together based on their potency or how strong they are. The World Health Organization's analgesic ladder is an example of this. The non-opioids analgesics, such as the paracetamol or the acetaminophen and NSAIDs, are recommended for mild to moderate pain. Then we have weak opioids, such as codeine, dihydrocodeine, or tramadol, are recommended for moderate to severe pain. And the stronger opioids, such as oxycodone and morphine, for severe pain. Now, let's discuss opioids and the term opiates. Do you know the difference between an opioid and opiates? It seems that every day there are dozens of stories about the harmful effects of opioids and opiates and how they are wreaking havoc on the families and communities. However, few people understand the distinction between the two. So let's define these two terms. Opiates are labeled natural because the active ingredient molecules are created by nature. The opium poppy, also known as Papaver somniferum, produces opium, which is a dried latex obtained from this plant seeds capsules. Opiates are drugs that are derived directly from opium. All right? So, opiates is a drug came from the opium that is produced by the opium poppy or the Papaver somniferum. So, example of these drugs are the morphine, codeine, and heroin. An opioid, on the other hand, is a synthetic or partially synthetic substance. This implies that the active ingredients are synthesized chemically. Because of their similar molecules, opioids behave similarly to opiates in the human body. So they both bind to opioid receptor to have effect. Okay, so example of opioids are fentanyl, hydrocodone, and other more. All right. Now, how about sedation? What is sedation? Sedation is the reduction of irritability or agitation by administration of sedative drugs, generally to facilitate a medical procedure or diagnostic procedure. So, sedation is the process of relieving anxiety and establishing a state of calm. The drugs used most often for sedation in the ICU actually are midazolam or our benzodiazepines and propofol. And this group of drugs called sedatives. All right? The routine use of sedation scales is instrumental in achieving effective sedation. So in the ICU, we use sedation scales to achieve optimum effect of the sedation. The sedation scales that is most reliable in the ICU is the Richmond Agitation Sedation Scales or the RAS. So if you are an ICU nurse, you are familiar with this, right? Okay. So when we talk about pain control, we use analgesics. And when we talk about relieving anxiety and irritability and making your patient calm, drowsy, and relax, we use sedatives. Okay? So, we frequently hear the term analgesia and sedation, and as well as anesthesia. What is anesthesia? So, I need to add this because most often this term comes along together. So, what is anesthesia? Anesthesia is a medical treatment that prevents you from feeling pain during procedure or surgery. So what's the difference between analgesia and anesthesia? Analgesia is pain relief without loss of consciousness and without total loss of feeling or movement. Anesthesia, on the other hand, is defined as the loss of physical sensation with or without loss of consciousness. So, if with loss of consciousness, we called it general anesthesia, and without loss of consciousness, we called it local anesthesia. Okay, that's it for now. I hope you like the video. So, on my next video, we're going to talk about the different kind of sedatives and analgesics that we use in the ICU. All right, thank you.